Theoretically, there are cases in which we can perform a fresh embryo transfer after doing the genetic testing of the embryos, but this is something that we usually do not recommend, because if you want to carry out a fresh embryo transfer, the biopsy should be done on day 5 and then the results should be available on day 6. And since embryos can also be tested for the genetics on day 6, this sometimes means that patients may end up with embryos that have been biopsied on day 5, embryos biopsies on day 6, some of them normal, some of them abnormal, and in these cases it's quite common that patients have to pay 2 different PGT. One, the technique that is done to carry out the fresh embryo transfer, and also another round of testing for those embryos that will be transferred afterwards, which are those that will be biopsy on day 6. So, though it is technically possible, we usually recommend to carry out the biopsy of all the embryos on day 5 and day 6, and once we get the final result, consider which one should be transferred.